Hi everyone, myself Dr. Prasad, Department of General Medicine. Till now we discussed about the physiology of HCl production and what is a postprandial alkaline tide. Now let's move on to some basic concepts and the different factors that are responsible for the HCl production and different drugs that are used to decrease the HCl production. Let's revise some basic points. We have parasympathetic nervous system and its receptors. The main neurotransmitter of the parasympathetic nervous system is acetylcholine. Coming to the receptors of the parasympathetic nervous system, there are two types, that is the nicotinic type and the muscarinic type. Nicotinic type receptors are NN receptors and NM receptors. Coming to the muscarinic receptors, these are M1, M2 and M3 receptors. Here we focus on the M1 receptor. What is the location of the M1 receptor? This is located on the stomach. So when the M1 receptor is stimulated by the acetylcholine, which is located on the stomach, this results in increased HCl production. Okay, so what is the physiological point behind this? So remember one thing, the digestion, urination and defecation, all these three are under the control of parasympathetic nervous system. So after taking the food has to digest. So for the process of digestion, the parasympathetic nervous system will activate. So you take the food, and after taking the food, our parasympathetic nervous system will activate for the digestion purpose. So when the parasympathetic nervous system activate, from the parasympathetic nerve endings, acetylcholine will release. Okay, this acetylcholine will go and bind with the M1 receptor, which are located on the stomach. So when the acetylcholine binds with the M1 receptor on the stomach, this results in increased HCl production. This increased HCl is responsible for the digestion. Okay, and some chemicals in the body known as autocoids. These autocoids are of three types: amino autocoids, lipid autocoids, and peptide autocoids. Amino autocoids are of two types: histamine and serotonin. This histamine has four receptors for its function. Those are H1, H2, H3, and H4. Here we focus on H2 receptor. So when the histamine comes and binds with the H2 receptor, it will stimulate the proton pump. So when the proton pump will stimulated, this results in increased production of HCl. In this way, histamine increases the production of HCl. Coming to the factors affecting the HCl production, after taking the food, for example, you just now completed your dinner. So whatever the food you are consumed during your dinner has to be digested. We already know that the digestion is under the control of parasympathetic nervous system. So during digestion, the parasympathetic nervous system will activate. So what is the parasympathetic nerve that supplies the stomach? That is the vagus nerve. Vagus nerve is the parasympathetic nerve that supplies the stomach. And during the process of digestion, this parasympathetic nervous system will stimulate. So when the parasympathetic nervous system stimulate, the nerve endings of the vagus nerve start secreting acetylcholine. Okay, this acetylcholine, which is releasing from the nerve endings of the vagus nerve, will go and binds to its M1 receptor. When acetylcholine binds with the M1 receptor, this stimulates the proton pump. So when the proton pump will stimulate, it start increasing the production of the hydrochloric acid. So in this way, our parasympathetic nervous system is responsible for the HCl production. This acetylcholine not only acts on the M1 receptors, but it also stimulates these ECL cells. What are these ECL cells? These are the enterochromaffin like cells. What is the purpose of these enterochromaffin like cells? These enterochromaffin like cells are the main source for the production of histamine. So This acetylcholine, which is released from the nerve endings of the vagus nerve, will also stimulate these ECL cells. When the ECL cells are stimulated, they start releasing histamine. So, when the histamine is released from the ECL cells, they go and bind to the H2 receptors. So, when the histamine binds to H2 receptors, it further stimulates the proton pump. So, when the proton pump will stimulate, again H cell production will increase. Apart from that, this acetylcholine will also stimulate these G cells. What are these G cells? These G cells are the gastrin producing cells. What is the location of these G cells? These G cells are located in the antrum of the stomach. So, when the acetylcholine is released from the nerve endings of the vagus nerve, it also stimulates these G cells. When these G cells are stimulated, they start producing gastrin. So this gastrin then go and bind with its receptor, that is a CCK-B receptor, that is a cholecystokinin B receptor. When the gastrin go and binds to the cholecystokinin B receptor, it further stimulates the proton pump. So when the proton pump is stimulates, this also start producing the HCl. In this way, the vagus nerve is mainly responsible for the production of hydrochloric acid. That is, the parasympathetic nervous system is mainly responsible for the digestion. From this, we conclude that the acetylcholine, which is released from the nerve endings of this parasympathetic vagus nerve, is mainly responsible for the hydrochloric acid production, that is a gastric acid production. In some conditions like severe acid peptic diseases, which are not relieved by prolonged usage of proton pump inhibitors, there is one surgical treatment is available. That surgical treatment is the vagotomy. During the vagotomy, the surgeon remove a branch of the vagus nerve which is supplying to the stomach. So, when the branch of the vagus nerve which is supplying the stomach is removed, then the acetylcholine is not available in the stomach. So, when the acetylcholine is not available in the stomach, then there is no question of production of the hydrochloric acid. In this way, by doing the vagotomy, the symptoms of the acid peptic diseases are resolved in the patients. Just now we came to know that this proton pump is activated when the histamine binds to its H2 receptor, when the acetylcholine binds to M1 receptor, when gastrin binds to cholecystokinin B receptor. So, if we block these receptors by giving some drugs like H2 blockers, M1 blockers, we can prevent the stimulation of the proton pump. When there is no stimulus to the proton pump, then there is no production of the hydrochloric acid. In this way, the H2 blockers, M1 blockers prevent the formation of the hydrochloric acid. Coming to the drugs that decrease the HCl production. Number one is the H2 blockers, the histamine blockers. And the drugs are the ranitidine, that is our favorite Rantag, and the cimetidine. Coming to the M1 receptor blockers, acetylcholine receptor blockers. There is a M1 receptor blockers. The drugs are the pyrazine and tirazepine. And third one, this is the most potent inhibitors of the proton pump. These drugs are proton pump inhibitors. Okay, and the drugs include pantoprazole, omeprazole, rabeprazole, and esomeprazole. All these proton pump inhibitors are the prodrugs. What are the prodrugs? Prodrugs are the inactive form of the drugs. Upon activation, they become active. So, these proton pump inhibitors are the prodrugs. They require activation for conversion into the active form of the drug. There is one more group of drugs which inhibits the proton pump, and the group is the PGE2 analogs, and the drug include misoprostol. Let's see here, this is the histamine and this is the histamine receptor, that is a H2 receptor. This H2 receptor is an example of G protein coupled receptor. This G protein coupled receptor has two components, that is GI and GS. GI means G inhibitor, GS means G stimulatory. So when histamine comes and binds to this H2 receptor, the GS portion of the G protein coupled receptor will activate. When the GS component of the GPCR is activate, this stimulates the adenyl cyclase. When the adenyl cyclase is stimulated, it converts the ATP into cyclic AMP. This cyclic AMP will further activate the protein kinase. This protein kinase finally stimulates the proton pump, which causes the production of hydrochloric acid. Okay, in this way, this histamine causes the production of hydrochloric acid. Coming to the misoprostol, this misoprostol is a PGE2 analog. So this misoprostol goes and binds with the PGE2 receptor. This PGE2 receptor is also an example of G protein coupled receptor, that is the GPCR. So when the misoprostol come and binds with the PGE2, this time GI portion of the G protein coupled receptor will activate. When the GI portion of the GPCR get activates, it inhibits the activation of the adenyl cyclase. Okay, so when there is no activation of the adenyl cyclase, it cannot convert the ATP into the cyclic AMP. So there is no formation of cyclic AMP. So when there is no cyclic AMP, then there is no stimulation of the protein kinase enzyme. So when there is no stimulation of the protein kinase enzyme, then there is no stimulation of the proton pump. So when the proton pump is not stimulated, then the HCl will not produce. In this way, this misoprostol cause decreased production or inhibit the production of the hydrochloric acid. Finally, please subscribe my channel, and if you really like this video, please click the like button and share my video and give your valuable comment. Thank you.